When this social services meeting starts, welcome everybody. The commissioner is here.
Rosano. Simpson.
Here.
Cleary.
Here.
Epicoro.
Here.
Andrew Joyce.
Here.
Miller's excused. Fine. Lockhart.
Here.
And Moriello.
Here.
Epicoro. The first item is approving the previous meeting minutes.
Motion.
All in favor?
Aye.
Opposed? Motion passes.
Item 2 is authorizing an agreement with Behavioral Health Services North for the provision of foster care services. Commissioner Manning is here this evening.
Good morning, ladies. Good morning. Sure. Good evening, Sharon. To committee members. Yes, this is actually a new program. It's new to us. It's Behavioral Health Services for Foster Care. So they actually are therapeutic foster care homes. So a youth that is removed could be much more in a supported clinical setting as well in a homeland setting. So we're really excited about this. We have 2 youth that have significant mental health needs and really could benefit from this program.
Are there any questions? Do I have a motion?
Just, oh, a question, you said we have 2 youths currently residing. What kind of issues would make them a good referral for this?
Just the behavioral health issues related to this one young lady who continues to run away, has a lot of charges against her. I'd much rather see her go through a therapeutic program rather than non-secure detention and go down the juvenile justice route. So she was one of the children identified through Raise the Lower Age. So as soon as she hits that 12 years old, she's going to go another route.
So she's under 12, okay.
Yes.
All right.
Are there any other questions? Do I have a motion? All those in favor? Yeah. Motion passes.
Item 3, authorizing an agreement with Schenectady County regarding the provision of evaluation services for the preschool special education program.
Thank you. Yes, we have an evaluation team that identifies our early intervention children as well as preschool education. So we have contracted for the past several years with Schenectady County to help them assist in their void for their 3 to 5-year-olds who are identified in preschool education. So, of course, Albany County children have priority, but we assist them as we can. And there is just what we can generate revenue-wise. Last year was about $5,000.
Are there any questions? Do I have a motion? Second? All those in favor?
Aye.
Opposed? Motion passes.
Item 4 is authorizing preschool special education provider agreements for young children with disabilities.
Thank you. Yes, this is for our related services that we provide to children that have been identified through their IEP or individualized educational plan. And they often include speech therapy, occupational therapy, and physical therapy. So we do get reimbursed 55% from the state for the cost of these services.
Are there any questions?
Sure. Is this one where the state sets the fee?
Correct. But we, because there were concerns, I think with some related service providers, that in 2024, in July 1st of 24, we increased the rate from $55 to $58. And then this July 1st, we will increase it again from $58 to $60.
When you say the state?
No, the county. The county, we're paying that in
County.
addition. Yes.
Okay, good, thanks. That's what I was wondering, because I know they've come to us a number of times.
Yeah, thank you.
Motion.
Motion. Second? those in favor? Opposed? Motion passes.
Item 5 is authorizing agreements with various school districts for the provision of preschool evaluation services for children with special needs.
Correct. We have to have these contracts in place with all county or school districts so we can actually conduct the evaluation and get them the services that they need.
Are there any questions?
Motion.
Second. All those in favor? Opposed? Motion passes.
Item 6 is authorizing an agreement with Spotted Zebra Learning Center regarding individualized education programs for young children with disabilities.
Thank you. Yes, this actually, Spotted Zebra really meets that threshold to request legislative authorization. So we really do, they provide a lot of services to the children 3 to 5 years old in Albany County.
Are there any questions?
Just tangentially related, do we have any backup state funding if we should lose some of our federal funding for the individual education plan?
We don't know how the federal is going to trickle down to the state and then hence then county. It is definitely a concern that, we have very early intervention as well as preschool education.
But there's some discussion about possible contingencies, correct?
On the state level, again, we're also waiting for the state budget to be finally rolled out. So it's on our radar and we're monitoring, as well as our agencies that we, participate with, like NISAD and WORK.
Okay, thank you.
Any other questions? Make a motion? Second. All those in favor?
Aye.
Opposed? Motion passes.
Item 7 is amending the 2025 Department for Children, Youth, and Families budget for administrative adjustments.
Thank you. Yes, we're excited to really be looking at adding a juvenile justice coordinator. We have a per diem part-time coordinator, but the needs of the juveniles that are presenting at family court and at probation really go beyond that need. And we really need to look at some additional programming for these youth that will meet their needs and hopefully not further penetrate the family court system. So we have proposed to add a full-time juvenile justice coordinator who will be stationed at our family court. But really looking at working with community members and really to find out what the needs of these youth are on the street.
Are there any questions?
We're just a little confused by the population. Is this a diversion?
It's really not. These youth are already engaged at family court, so we track them. They're involved in probation, so this individual will be working very closely with the probation department as well as family court, so he or she would know who's going into secure detention or non-secure detention or need to be placed further away.
So with these kids that would be qualified for this justice coordinator, be in secure detention?
Some may, some are in non-secure detention. They may be in a residential program, hopefully not rising to that level, but they really look at what the needs are. And again, working very closely with probation, and so maybe some of the diversion kids that aren't identified. But we track them, we collect data on it, and this is also SUNY Albany does the evaluation.
So you get a lot of kids through family court and through probation. So what makes one qualify for this versus just going to probation?
I think it's much more of a collaborative effort between the departments, DCYF, probation, and family court, that we're all working together in the same vein, if you will, and that we're looking at, this individual will be looking at what services are effective in keeping youth, A, in the community, or B, not to further penetrate the system.
Can you, when you were talking about the per diem therapies, what therapeutic settings or therapists are you using? Are they using?
What,
Is it,
like it's, they're,
is it Trinity? Is it?
oh, no. Typically, the related services are like the OTPT speech is what you're referring to. They're typically either private providers that we contract with, or they are center-based programs for the 3 to 5-year-olds.
No, we're talking about the services coordinator position, the juvenile justice.
Okay.
So they wouldn't be the 3 to 5-year-olds.
No.
But in the backup, we talked about $62,733 for per diem.
So what happened there, we took these 2 lines, the riot coordinator and the caseworker,
Correct.
and combined them to
Yeah.
make the juvenile justice coordinator at $58,500. And then this was the additional monies left over. We put it in per diem therapies because we always, like for example, the related services, we have to come up with that money for the difference. So that's where it's in per diem therapies.
Okay, so that's what I was wondering, what services particularly would apply, like the 3 to 5-year-olds, that's a different, okay, for a different program. These kids are presumably a little bit older, if they're in family court, non-race age, correct, non-race age.
They can be raised the age too, yes.
Oh, okay,
We
because that's
identify them.
non-race age.
We can. We track the data, I should say, on those, non-raise the age.
Okay, I think I'll give you a call.
Okay.
I got too much into the weeds, I think.
In the beginning of your presentation, you said that there's more of a need now, so it sounds like there's servicing more individuals.
Yes, there's much more violence in the community. Our secure detention is full. Non-secure, we actually had to go out to, I want to say it was the Syracuse area last week for a non-secure detention youth because they did not have any beds. So it really, more children are being identified in the juvenile justice system. So that's why this person would really be looking at what is the programming, and also the legislature has provided us with some monies to provide additional services. So we're exploring what services are currently being provided and which ones are really effective in not penetrating the system further.
How many people do you think you serve?
I could get you that number, I don't want to say off the top of my head, but quite a few. Because we have a whole adolescent services unit at Family Court, so they're the ones who are responsible for placing the children and monitoring them while they're in residential program or secure detention. And we have a unit of 4 over there.
Yeah, if you could let us know, I appreciate it.
Sure.
Thank you.
Just one more. It said in your backup about that, what I'm really concerned about is that the number of admissions to detention have been steadily rising over the past year, and the highest percentage being the non-raise age kids, okay? And approximately 50% of those kids are put into secure detention. That's a lot of young kids, and I know you're probably talking about 12, 13, 14-year-olds, kids that are committing some, if they're going to detention,
Right.
serious crimes, carrying guns, assaults, serious stuff. And we're seeing the increase. Over the years what do you think that a county, you've been there a long time, what do you?
I think the increase to access to weapons and that there almost isn't any consequence for some of their behaviors.
Yeah.
And that, when they go to probation, they just feel like they have to do their time and then they're done.
It's true.
And then in addition, there's still gang activity out there.
Yeah.
And we've had to move children all the way to Buffalo from secure detention because of the gang activity that occurs.
It's just so disheartening, because for all the years we've talked about all the programs with it, but we've never seen them fix it.
Yeah.
We've never seemed to be able to get
And
it.
I think the biggest thing and the one thing that we're focusing on is the engagement of these youth and using, credible messengers, someone that maybe has gone through the juvenile justice population. We're working with a program called Fourth Family. They're assisting us in getting a advisory board together of youth and really working with them. One of the gentlemen who runs it has a history of prison involvement. So he's walked the walk and he knows
Yeah.
what these kids are going through. And I think the other piece of, not having a supportive family.
Yeah.
They go with gangs right, because they don't get the support.
Thank you. Thanks for taking the time.
I also don't want to get in the weeds, but thrilled that you added this position. Hopefully we can do a little bit more, and we're kind of adjusting as we go based off the need. Can you just kind of touch briefly on your staffing now, how many vacancies you have, and how you expect to fill this vacancy?
My hopes are that one of our caseworkers, maybe even someone from the family court, would be promoted into this position, who already has the experience with the family court system, with the players in the community, and that's my hope. But we will be, once we get approval, we'll be posting this and putting it out on Indeed, just to make sure we have a broad net, that we want to get the best person for the position.
And generally, how is staffing?
Staffing is very good. We only have one caseworker position right now, and the one area of challenge is our mental health clinic. We cannot find staff social workers. So if anyone knows of any staff social workers, we would welcome their resumes.
Is this a competitive position? Do people have to test for it?
I don't know. I would think yes, but there's also the HELPS program that's currently on, and we could probably get this position on.
I'm
Yep.
better about that.
Yep.
They're licensed social workers, right?
This, yes, at the staff social worker, yes. Mhm. Licensed clinical social workers or licensed masters.
Thank you. Morris, I'm just looking, going back to the big picture on the RLA sheet. I didn't see anywhere how much of this is county, how much is state, how much is federal. Those are all blank on the RLA sheet. And what the total amount is. Now, I know you've got a spreadsheet elsewhere that talks about, moving money around in the county budget. But just of this expenditure, is it all county funds?
I would have to check with my financial person, because in child welfare, we do get reimbursement from the state. So I would have to see if this was a position, because now that it is going into be in the county budget as a civil service position and a union position, that we should probably be able to get reimbursement, but I can't answer that 100%. So
Well,
I'll get
what I
back.
was trying to figure out was, this sounds like a new adjunct to assist with lower age kids that have legal issues. There's been a whole lot said about raise the age and the state not providing enough backup and money to take care of that. And I wonder if we're starting to fill the void that the state had promised us. And so that's why I would like to know, what the funding breakdown for this program is. Because it seems to me it's something that should emanate from the state. But I don't see it anywhere in here.
Are there any more questions? Have a motion?
Motion.
Second? All those in favor? Opposed? Motion passes.
Item A is amending resolution number 21 for 2025 regarding the Healthy Families Home Visiting Program.
Thank you. Yes, the OCFS, has increased the budget for Healthy Families Program. And what we want to do is not only amend the budget, but also add a family service specialist. This individual would be working with the families. And because there's a child welfare protocol that they increased this year, so basically Healthy Families can accept children in the child welfare program up to the age of 24 months. Before you had to be in the program before the child turned 3 months of age. So this is expanding our opportunity, and we'll be able to serve more children.
Are there any questions? Have a motion? Second? All those in favor? Opposed? Motion passes.
Thank you.
Commissioner. I have a motion to adjourn. Good, sir. Meeting is adjourned.
Social studies.
Listen, I can't tell you. French fries.
I don't know if they were forever anymore.